I'm Mariana Figueroa. I'm a professor at the Department of Population Health Science and Policy and director of the Light and Health Research Center at Mount Sinai. Well, SAD or seasonal disorder is typically characterized by depressive symptoms that occur at specific times of the year, fall and winter in general, and there's a full remission in other times of the year, such as the spring and the summer. The causes for it are still unclear, but there are some competing hypotheses. Some of them include that circadian rhythm disruption, your photoreceptors in the eye do not respond very well to bright and dim, serotonin reuptake dysfunction, but one of the most prominent hypotheses is that the biological clock in the brain, it's out of phase with your natural day-night cycle. So your clock is telling you it's 6:30 in the morning and your watch is telling you it's 7 o'clock in the morning, for example. So that mismatch is some of the causes for seasonal depression. The symptoms vary, but in general, it includes lack of interest, pleasure, lack of sort of energy, feeling depression, feeling down. What's very interesting is that there's hypersomnia, so people tend to be sleepier and want to be in bed more. And there's also another very, very interesting characteristic, which is they tend to overeat, especially carbohydrates. So the person craves for carbohydrates. And of course, as with any depression, there could be some trouble feelings such as suicidal thoughts if it is a little bit more serious, the symptoms. It tends to affect people at higher latitudes, and that's because at higher latitudes, especially in the winter months, you have less daylight availability. So the prevalence of SAD, it varies between like 1 and 10% in the population, and the higher prevalence are at the higher latitudes. But it can happen at lower latitudes. It's just less prevalent. Typically, the higher you go, the less daylight availability, the more you're going to see people experiencing SAD. Well, obviously, if you go to a physician, there's structured and standardized questionnaires. They're typically used as sort of the gold standard. But in general, I think if you start around October timeframe, craving carbohydrates, losing energy, losing interest in things, overeating, oversleeping, that's a good sign that you should probably seek some help and be formally diagnosed with it. But in general, it's around October, November, when the days are getting shorter, that's when you start having these symptoms of SAD. The main difference is the seasonality of it. So the seasonal affective disorder, you actually have a remission in the spring and the summer. With depression, you don't. A second, I think, less important difference is with seasonal affective disorder, you actually have hypersomnia, so you tend to sleep more. With depression, you tend to have insomnia instead of hypersomnia. So those are very, very marked differences, but I think the seasonality one is really the biggest one. By March or April, you're back to being normal again if you only have seasonal depression, and that's not the case with depression. There are 3 ways, obviously, to treat SAD. One would be medication, and obviously a physician would have to be prescribing that. But another non-pharmacological way is morning light, and the reason is the idea that your biological clock is delayed with respect to your watch. For example, if you get that morning light, what that morning light is helping you advance your clock, so it makes your clock resync with the time on Earth or the local time on Earth. So this is a very easy way to do it. It really is. At home, you would add more lights, you would open up windows. Of course, you have later day breaks during the winter months, but try to, after daybreak, try to be outside, be in the porch, open up shades, sit facing a window, Or if you can't do that, increase the amount of light that you have at home. So turn on all that light at home, increase that amount of light, because that helps the environment be brighter and helps you get more light in the back of the eye, which is what you want to be effective for seasonal depression. Yes, it has. It is interesting that for seasonal depression, it is a recognized treatment. So if you go to your physician, the physician may actually prescribe the light therapy, and you may get reimbursement for buying, for example, if you need to buy a light box or light fixtures to increase the amount of light in your house. But we have done a lot of studies showing with other populations, there's actually a very benefit of exposing people to higher light levels during the daytime. And it's very important because what we really need is bright days and dim nights. So you increase the amount of light you're exposed to during the day and you reduce in the evening. So we've been doing that with Alzheimer's disease patients, for example. We've been changing the lighting in the homes, changing the lighting in nursing homes and assisted living facilities. And we're seeing a very, very strong, robust impact on improving their sleep, their mood, their behavior. We're also working with persons with mild cognitive impairment, as well as Alzheimer's disease, but also mild traumatic brain injury, people that suffer from sleep disturbances from the brain injury, people that are undergoing cancer treatment, and we're using light to improve their sleep and reduce fatigue in this population. For example, we've been working with breast cancer patients as well as myeloma transplant patients. We're delivering the light during the transplant to minimize fatigue and improve their sleep. So there's various applications, even trying to get your teenager kid to go to bed earlier and wake up earlier. You can use light for that as well. So there's many applications that we have seen positive effect of light. Yes, the lighting in your office could be making you sleepy. And the reason why is, light has two impacts on people. One of them is that impact that it shifts the timing of your biological clock so that you are in synchrony with your watch. And that's what we have been talking about with seasonal depression. But light has also a direct acute effect in the brain, similar to a cup of coffee. So light makes you more alert. So during the daytime hours, if you are in a dark room, in a low light level room, you tend to be sleepier. If you increase that amount of light during the day, you actually get perkier because of that cup of coffee effect that light can have. So we recommend for two reasons for you to have brighter days. One is for you to maintain that synchrony with the light dark cycle and with your watch, external watch. And the second one, it really is the cup of coffee effect, which is having that direct, acute, very fast effect that increases your alertness and make you less sleepy. I'm assuming that the fatigue that you're mentioning here would be things like eye strain, or when the lighting is very uncomfortable, it gives me headaches. And in that case, you really want to avoid the direct view of the light source. So you think about a bulb, you don't want to be looking directly into that bulb. You really want to have indirect lighting in the space so that you're illuminating. Think of it of a window, a north window, where you only have daylight coming in, but you don't have sunlight coming in. So it's that diffuse light that makes it more comfortable to work with. You also want to minimize the amount of sunlight coming in to your workspace, your computer screen, your eyes, because daylight is good, but sunlight, not necessarily, because it can be very uncomfortable. You have to squint because it's your natural reaction to it. So try to increase the amount of diffuse light in the space, ambient light, and minimize direct pulls of light in the space. First of all, during the daytime hours, you want brighter amounts of light than what you probably have in the homes, because we typically tend to have low light levels at home, and we should keep those low light levels in the evening. But during the daytime, when you're working, you actually want to add, I want to say 2 to 3, even sometimes 4 more lamps, table lamps or floor lamps around you. This way, you're increasing that amount of ambient light around your space. So everywhere you're looking, you're actually looking at a brighter space. Now, if you have a window and you can sit by a window and face that window, assuming that there's no sunlight coming in, only daylight coming in, it's absolutely the best light source that you can have, because it's bright, it's the right color, it's on at the right time. So daylighting is really a very ideal light source for us to work under. But if you can't have, if you're in a basement, for example, what I suggest is you use table lamps and floor lamps that are close to your space. Rather than trying to get everything out of the ceiling, try to bring that close to your space. This way you get enough light without having to add too much light coming from the ceiling. As I mentioned, light or daylight. And again, daylight being an ideal light source, just because, we were historically, that's where we come from, being outside during the day and being by fire at night. So we sort of evolved to be in bright days and dark nights or dim nights. So daylight is ideal because it's a lot of light first. It's just, for example, in a bright sunny day, you get about 50 to 100,000 lux of daylight. Indoors, you probably get 200 to 300 lux. So that gives you an idea of how much less light we're getting indoors. So daylight is ideal because it's bright, and it does have a lot of short wavelength or blue content, which is the light that we need to maintain that synchrony with our biological clock. So for example, we just finished the study that we did at the Exo building in Reston, Virginia. And it was a very interesting study because these are smart windows that they have in the building. So these windows, what they do is they change the transmittance of the light according to the heat and the sunlight. So for example, if there's too much heat or too much sunlight coming in, they filter out that IR so that it minimizes that amount of sunlight or heat coming in. So all you have coming in, it really is the quote unquote, the light that doesn't give you that much discomfort. But that light is actually very good for the circadian system. So what we did is we compared regular windows, clear windows with shades, and those smart windows, which you don't have to pull the shades because the window itself is removing the sunlight, which would be uncomfortable for people to see. And what we found was extremely interesting. In just 1 week, if people are exposed to that smart window, which allows daylight into the space, they will sleep better. They would have earlier sleep onset, so they will fall asleep earlier when they go to bed. They had fewer anxiety and mood and depression feelings, and they reported feeling better. So it's sort of like underscores the importance of bringing daylight into the space, if you can, during the daytime hours, because it's just something that will help you sleep better at night. And when you sleep better at night, you have very positive health consequences from that, to a certain extent. So we have done some work where we collected data with the iPad night shift using self-luminous displays. And we did see that there's a reduction in the suppression of the hormone melatonin. So hormone melatonin, it's a hormone we produce at night and in darkness. Melatonin typically rises in the evening about a couple of hours prior to your normal bedtimes. And what happens is if you delay that onset of melatonin, you're delaying that signal to the body that it's time to go to bed. And if you're exposed to too much light in the evening, you would suppress that melatonin onset and you would delay that signal to the body. So you would delay your sleep. So what we were able to show is if you're doing self-luminous displays and you put the iPad night shift mode on, there is a reduction in that impact on melatonin, but it's not 100%. It's not complete. So you still have an effect. So if you are looking at your display for 3 hours before going to bed, even with a blue light filter, you're still going to have an effect. Albeit it's going to be a smaller effect. So it's going to help, but it's not going to completely take away the problem. Let's put it this way. So I guess the best thing is it's better than nothing. So I do recommend using it. But remember, it's not something that it's foolproof and it resolves all the problems.